All right. Welcome to the hottest show still on the planet. I know it's been a while since we've been on, and we have a lot of things that's going on in our personal lives. So we're going to start calling this, Chantele, the new pop-up podcast of IC Grade with Class, because we don't know exactly when we're going to pop in. All right. So everybody be aware when we pop in. Again, I am your host with my co-host. I am Aaron Lavender, and my co-host is Chantele. She goes by one name, right?
That's all you, Aaron, but I will go with it.
It's been a while. I miss you guys out there. A lot has been going on in 2025. We have some serious issues that's going on in our country, and we have some very special guests. Chantele, you set this up. I'm gonna let you lead the way with this, and we're gonna make things happen. And we really want to talk to the people out there in our community, because what we do is we talk about things that impact our community. And that's really important to understand. Yes, it's great to know what's going on in the world, but a lot of what's going on in the world affects us personally. So I think it's important to let you guys know from I don't like to say the horse's mouth, because I don't like to put that on people like that. You know what I mean? Ain't nobody eating horses over here. You know what I'm saying?
Yeah,
we're real live people. But I want you guys to hear from those that are personally affected by their agencies. So Chantele, can you lead us off with that?
well, what we have, our special guests is Vickie, Loveland, Lisa Graham, Laura Pipis. They are leaders in our community in the Health and Human Services area, but they are also a part of our community coalition. So Lisa Graham put together a few years ago the community coalition to get Health and Human Services agencies in our community working together and being in conversation together so that we could continually improve. And it was a really great move that helped us become more solidified in terms of partnerships.
Sure.
So, boy, are we thankful for it now, because we have some things going on where there's some budget cuts, some federal budget cuts that are starting to really affect the services that we can offer. And so Lisa pulled together an emergency community coalition meeting the other day, and it was for the purpose of just talking about the budget cuts that were going on. And so I'm going to let her start by just explaining what she was notified about and why she gathered us together.
And Lisa, when you introduce yourself, for those that don't know you, tell the people who you are, what agency you work for, and we're going to do that with the rest of you guys too.
Sure. Thanks for having me on the show. Thanks for having the show, really, because this is really important. I'm
we lost
Lisa Graham, and I'm the CEO for Monroe Community Mental Health Authority. I have been, I'm sorry. Okay.
No, we lost you for a second, Lisa.
CEO for Monroe Community. Oh, okay. CEO for Monroe Community Mental Health Authority. I have been with CMH for about 24 years, been the CEO for about 9. And so the reason I let everybody know last week that, maybe towards the end of March, we probably all saw the headlines that said, Michigan was going to lose about $380 million in federal grants that had already been promised, already been awarded. We didn't really know what programs exactly were going to be hit by that, but we knew that was coming. And then we learned then that the Attorney General, Dana Nessel, she had filed suit along with 22 other states to try to stop that termination of funding. But then on April 1st, we got word that these people all the agencies that had been awarded those grant dollars received stop work notices, meaning just, okay, as of today, you can't spend any more money of this grant that you were awarded and that you were counting on. I knew that there were a number of agencies in Monroe County that received those grants, and I was worried right away. And then when I started seeing actually who was impacted, I knew right away that this was not going to be good for our county, and probably not for lots of other counties. And so that's why I pulled the group together so we could talk about the cuts that people received and how we were going to, what we were going to do about that. Because our community coalition, when we started a few years ago, like you said, Chantele, we really wanted to say, what are the gaps in services in our county? How can we all work together to address those gaps and work as partners? And so that's why we had that meeting. Monroe County had about between 8 and 9, well, I'd say about $900,000 in federal grant dollars that have been impacted by that stop work notice that came out. And those are primarily in the area of mental illness, helping to treat mental illness and substance use disorders.
So you pulled together representatives from CMH, St. Joseph Center of Hope, Paula's House, Oaks of Righteousness, Salvation Army, Monroe Public Schools, ProMedica Hospital. I don't think I'm forgetting anything. Lisa, can
Ty's
you?
house.
Ty's House, yes. Okay, we'll
Gabby's
pull this all
Gabby's
together.
ladder.
Yep.
Gabby's
that's-
ladder. Mm-hmm.
Yep. So that's a really great transition into introducing Vickie, because Vickie, you oversee something that gathers all of these people together. Could you tell us about that?
Yeah, so I am the development coordinator for the Monroe County Substance Abuse Coalition, and our coalition actually formed back in 2006. So we have been in existence for almost 20 years now. And, you know, I do want to say, I always have to say this, I do have to give a huge thank you to the United Way, because they are the fiscal agent for our coalition and have been since day one. And so we are impacted by this. We actually were allocated approximately $37,000 in the ARPA funds. Fortunately, we have spent out the majority of them. So we have approximately 13,000, with hopefully another 4,000 that we can bill out for the month of March, because we are told that we can turn billing in until I think April 10th. For the month of March. So we are looking out for our coalition. We probably are the least impacted, because we're looking at a loss of about $9,000. And so we do have another funding source for the coalition. It's PA $2, which is liquor sales tax that helps support our coalition. So that is untouched right now, but certainly, you know, the ripple effect of that in all of the agencies that are, you know, more impacted than we are right now. So, you know, our coalition, I definitely think, you know, we are certainly the hub of it all. You know, with all the agencies that we work with and the partnerships that we create, we do have to have sector representation as part of our coalition. So we have many leaders from local agencies that are part of that. And that's where we are able to do some program development, public education, you know, information dissemination, things like that. So again, you know, we don't work directly with clients, but certainly the coalition is huge in our community. And we've been able to provide activities and strategies that quite honestly weren't in existence or had not been in existence for a long time. We do a youth summit that we've done every year for 5 years. It's the hashtag I Matter Youth Summit. We do Red Med boxes. We're a result of the coalition, a partnership with the Monroe County Health Department. We do compliance checks with youth decoys for alcohol and tobacco. And then we have student prevention leadership teams that are a huge part of our coalition. So there's a lot of good in our coalition. And I know that I've been told, our coalition has been told, that we are looked at a lot from other counties and how our coalition is ran and how we are set up with the sector representations that we do have.
Yeah, and I'd like to say, Vickie, although the coalition does not do direct work, you are really one of the reasons why we hope there won't be so many people who will need direct services, because you all do so much prevention work. And we don't get funded to do prevention. We get funded to do treatment, and some of the other agencies too. But the work that you all do, you know, you are producing results so that hopefully so many of our youth are not going to grow up and be in need of substance use treatment.
And thank you for that, Lisa, because I think, you know, that's the hard part with prevention sometimes, is we do certainly have data that we look at very closely, and we're fortunate enough to have a data tool called the Michigan Profile for Healthy Youth. But again, it's very hard sometimes, you know, to measure the success of prevention, but we know that, you know, if we can make an impact on one person, and the earlier we can start with our prevention strategies, then hopefully, you know, we can, you know, eliminate an addiction or a dependency on any substances later on in life.
Absolutely. Thank you so much.
Yeah.
Rebecca, I'm really glad you joined us. I'm saving Laura for last because she's doing such data collection and things like that I really want to have her introduce herself right after you. So would you mind explaining your position and all the things that are involved in these cuts?
Well, hello, my name is Rebecca Turner. I'm the program manager for St. Joseph Center of Hope, and I was actually just working on data for Laura. But so you guys caught me in office right in time. But we were affected by the funding cuts. Roughly 90 to 95% of our budget is ARPA. which is 600,000. We've spent out roughly 300,000 to 330,000, but it hit us very significantly. We're trying to scramble right now. But what we do is we offer crisis intervention to those with substance abuse, opiate abuse disorder, or mental health mild to moderate crisis intervention. So individuals will come to us off the street in active addiction, active mental crisis. This is where we partner with CMH and all the other partnerships in the community to help get these individuals into the next level of care that they need, whether it's residential treatment at Salvation Army, whether it's wraparound services with recovery advocacy warriors, whether it's more work with volunteering with the Substance Abuse Coalition with Vickie. There's so many different programs that people can get involved in. So that's what we do. We just try to help. We're like the airport. Which kind of plane do you want to go on? Do you want to go to Harbor Light? Do you want to go to Sacred Heart? Do you want to go to Touchstone? Do you want to go to Paula's? All these different options.
Really great. So your cuts, can you talk about that specifically, Rebecca? Like, how is that going to affect you?
If I don't come up with funding, we will be closing our doors May 15th. So that'll be a significant impact to the community, because since we've opened our doors in November 2018, you have seen the opioid overdose death rate decrease significantly. So that is our biggest concern. And then where do the individuals go? So we're a deterrent from like the hospital, so they're not filling up the hospital beds, or for the police or sheriffs or fire, if they see an individual on the street, rather than going to jail, get them into treatment immediately for help. Everybody's just going to be on the streets. So I'm not exactly sure what we're going to be walking back into again.
Mm-hmm.
Wow.
I remember, so Chad Tolstead was sitting in our meeting and he couldn't be here tonight, but he talked about you being such a significant resource for the police. So a lot of times he can redirect some situations to you, rather than taking someone to jail when they really shouldn't be in jail in the first place. They're in need of help and assistance, but that may become the only option, or maybe on the streets again where they shouldn't be either, because they're ready for help.
Correct.
Absolutely. Laura, thank you so much for joining us as well. I would like for you to introduce yourself next, and just talk about what you're doing now because of all of these cuts.
Good evening. I am Laura Pipis, Executive Director of the United Way of Monroe and Lenawee counties. We currently fund about 27 agency programs in Monroe County and about 10, 11 in Lenawee County. And first of all, let me just address what these ladies have said. These ladies are the safety net in this community of people with mental health and substance use disorder. Vickie's part of it is trying to prevent from having people in those situations in the future. I see what all these people do. I'm part of the opioid task force. I'm part of the Substance Abuse Coalition. And the partnership in Monroe County, I just want to say, is excellent. And the fact that Lisa was able to pull together everybody for this particular crisis, it was amazing. And when all of this started happening, even before a few weeks ago, when you sort of heard rumblings about federal funding being cut, I think about our agencies that we fund and in just the whole health and safety network. I call it the safety net in our community. How would that be impacted? So I asked agencies and other folks in the area of health and human services, give me the data. I want to know what the impact is going to be in Monroe County. And what we talked about tonight is one slice of it, the mental health and substance use piece of it, which is so important. But I was also taking a look at other pieces like the SNAP benefits, HUD, housing, and Medicaid, that kind of thing. But I did, first of all, ask our agencies and other community partners, give me an idea what we're looking at here. Should any of this be in danger? And just in the last few weeks, and I also met with Val Orr from the Community Foundation and Stephanie Kasperzak from MCOP, to take a look at this. Even just the initial eight groups that emailed me and reached out to me, that's about $6.7 million in this community. And then adding, from our meeting the other day, adding this mental health and substance use dollars, it's up to about $7.5 million. What do we do as a community? We as a United Way and in the Community Foundation, we can't raise we cannot fill that gap. What do? we mentioned how important it is for young people to learn about substance use and prevent that for the future. We know that there's people here with mental health issues and or dual diagnosed as substance use disorder. What would happen if we didn't have this, have this funding? So that's what spurred me to say, I need the data. I need to know what's going on. I need to be able to make a case statement for our county to say, look, we have to take care of our own. These, we wouldn't be on, those of us who are on this Zoom meeting, that's what we do. We're concerned about other people. And so I just said, I wanted from macro level to take a look at what are the different areas. This is one of them. Like I said, housing, food, Medicaid. I can give you some statistics just in Monroe County alone. There's quite a few people that affect SNAP benefits, which is food stamps. There are 15,689 people in Monroe County that get food stamps, of which just a little over 6,000 are children. And by the way, the Michigan Department of Health and Human Services puts this data out every month. So you can look it up on the MDHHS website. And
So Laura, those are going to be cut?
well, potentially, I mean, and under Department of Health and Human Services, this is the first round that we've heard about was actually said, hey, stop funding this substance use disorder and mental health. So I was just anticipating what else, could possibly be cut. Yeah. And because all of these things are on the chopping block, I think it could happen any day. So I want to kind of get ahead of this. This is the first one that came out, so we have to deal with it, And on Medicaid, just in Monroe County, there's almost 2,500 people that receive Medicaid benefits. And I mean, first, you're muted.
Yeah.
25,000, Laura?
No, 2,500.
2,500 people receive Medicaid benefits in Monroe County?
Yep.
Okay.
Yep.
First, let me say thank you for coming on and sharing this information with our viewers and people that's going to be seeing it not only in our community, but around the country. And I am honored to be on with you women, you powerful women that are doing God's work, and you're trying to help our community and our children. And I don't want to gloss over the elephant in the room that a lot of people will make this political and pitting one side versus another. But the kids don't care about if you're Republican, Democrat, or an independent. They just want to know where their next meal is coming from. That's the problem that I see so much, that when people argue and bicker over things that really don't matter, what really matters, are we taking care of our people in our community, regardless of what political party they belong to?
Absolutely. Absolutely.
We're all human beings, and we all deserve respect. We all deserve a healthy meal and a roof over our head. And I just want to say I appreciate the work that you're doing to help try to prevent this becoming even worse than what it is. So thank you for disseminating this information to our community. I just really want to say thank you for what you do.
Aaron, I love that you said that, because one of the reasons we wanted to do the show, and we talked about this at the meeting, is that we're hoping that our representatives, our politicians who were voted in by our, where we live and are supposed to be representing us, that they will take the time to watch this show so that they can actually understand how it's impacting us. So I want to revisit that for 1 second. Sure. St. Joseph Center of Hope has a federal grant that was $600,000 annually. They've already spent $300,000. That the rest of the funding stops April 10th, correct? The second thing is Paula's House. They have a loss of $15,000 of a $45,000 grant, that because it has immediately stopped on April 10th. There are women's specialty services in our county, so that they can have access to therapy, peer support, case management for women, program to help clients to regain their children, rebuild careers, expunge records, assessing future viability of staffing. They lost $200,000 as of April 10th. Ty's House lost $70,000 as of April 10th. It's the only male transitional housing we have as an option in Monroe County. It accepts MAT clients, supports job placement and stability, and it will for sure reduce bed availability for that. They haven't announced that they would be closing, but it will do that. The Monroe County Substance Use Coalition is $9,000 shortfall from an $85,000 annual budget. So the law enforcement is testifying that St. Joe's has become an essential division site for intoxicated individuals, reducing jail and ER burdens. The health systems of ProMedica, we had a representative there, and they talked about how St. Joe's provides transitional care for discharged behavioral health patients. I can testify that a lot of times when people are released from the psychiatric version of the hospital, that they are not truly ready to transition into like the next stage of being independent. And that's where St. Joe's plays a huge part. And so the recidivism will end up going way up because of that, which will increase our healthcare costs. Community partners like Oaks of Righteousness and Salvation Army and others depend on St. Joe's and Ty's House for immediate shelter and stabilization. School and prevention professionals, long-term ripple effects are expected to impact youth, families, and school readiness. I know from the Monroe Public Schools aspect, those are the stories that I hear from students. My dad's staying at Ty's house, or, my dad's in the hospital, and, oh, honey, I want you to know you can count on some resources in the community. That's not going to happen. We see an impact and a ripple effect that happens in our community as well. So we did this show because we want to make sure that in hopes our community would reach out to their politicians, the people that their county commissioners. You could start there. You could contact your county commissioner and explain the impact on the programs, or just say, we really want these programs to stay. A lot of these programs have been in our community for a long time, and they have a wonderful reputation.
Chantele, to that point, I just want to say, I did reach out to Senator Joe Bellino. He was very responsive, and in fact, I have a meeting with him on Thursday. And so I know he's been very supportive and helpful when it comes to mental health and substance use. He was a big advocate for St. Joe's. So I was happy to get that response, but we still need to reach out to all of our representatives. There are a lot of representatives, elected officials. And as I say, if you've ever posted about how important mental health is or how important substance use treatment is, now is the time to do something. Just make a phone call, send an email. If you come to Monroe Community Mental Health Authority's webpage, we have a resource link that gives like how to email all of your elected reps. So you don't have to go searching, just come to our page and we can help you get there.
So just in case we could wave a magic wand and there were people out there that may want to donate a large amount of money to some of these agencies, how does that happen? Maybe Rebecca, especially with your organization, how could that happen?
Well, anybody can, there's a few different ways you can do it for us, especially we're going to be starting a media campaign, which you'll be able to follow on our Facebook page. But if you go to Catholic Charities of Southeast Michigan online, off of your Google search menu, you can actually pull up the donation buttons and specifically request for St. Joseph's Center of Hope. If it makes it a little bit more realistic for us to stay operational until 9/30/25, it's going to be about $167,000 that we need to come up with. But we're going to continue to try to see other areas that we can as well, find additional funding.
Okay.
But yeah, gift cards, gas cards, food, clothing donations, anything that can be given that'll help bring down our costs, hygiene, paper products, toothbrushes, toothpaste, things like that.
Okay. And Laura, could they give to the United Way as well?
Yes, you can absolutely give to the United Way. You can donor designate it to a specific agency or program if you like. And it's on our website, unitedwaymlc.org, or call us at 242-1331, or stop in and see us at 216 North Monroe Street. I think the advocacy and the awareness is really important. And I think that's why we gathered. We want people to know what's going on.
Yeah, and I want to piggyback off that, Laura. And I'm talking to the people that's out there that's watching right now, that the numbers that they're talking about, the data that Laura is talking about, these are real people. This is not some fictional numbers that's being thrown out there. This is real people and real money that's being lost in our community. And it's up to us as a collective to use our voice, to use our courage to say we can demand that they do better by us, the people. And that's in our power. And it's up to all of us to come together, regardless of what political party, again, that you belong to. This affects everyone, not just one group or another. It affects everybody in our community. And I challenge you out there to do something about it, because we can.
You know, Aaron, I love that you said that, because I know that on Icy Gray, we kind of sometimes say, I guess, let me just own it. I say the hard things. I guess my question is that I'm wondering, Rebecca, did anyone ever call you and say, how will this affect you if we cut these funds? Did you get any kind of conversation, any kind of phone call from any politicians after it was made?
None.
Right.
Honestly, my first line of defense, because I was trying to stay off the news and the fear, was Lisa Graham. That was what had set my head in motion on that, but nobody has reached out. In fact, the very first engagement center in the state of Michigan, created by our director from when I first started, Wendy Kalininski, actually already closed in Washtenaw. And Dawn Farms is also having their Roots program for their families in recovery for transitional, their funding was stopped as well. So I'm seeing it go multiple across everywhere.
I have a question though. Rebecca, was there any way, I don't know if this, you can help me out with this. Is there still opioid funding that you can get to help with what's going on there? Is that funding still available to you or available to anybody to use?
I'm hopeful that there is. I'm going to go to the county. I've already sent an email out to Mike Basonic and a couple of the other individuals. I want to say it was Friday morning, requesting the minimal amount that we'll need, our sustainability plan, how we're working in different areas with different grants, different fundraising opportunities, campaigns. But that's just what we would need, just to say operational, just for a little bit.
Yeah, so I was asking that question, Rebecca, because, and I want to ask that of Laura and Vickie too, just jump in if you guys did receive any phone calls as well. But I think that some of the things that we should be able to count on in terms of leadership, and when you're voted into office, is that when these things are happening, we're getting phone calls from our politicians. So I'm making a hard ask here. No one on this, this is all me. I'm coming from a bias that leadership means that you take care of the people who have entrusted you to lead, and taking care means communication and brainstorming. And so Deb, I'm trying to remember her last name, but and kudos to her, she attended our community coalition meeting.
Right.
She's part of our community coalition. She has gotten on the phone with Wahlberg and other people. She stated that they didn't know anything about the cuts, yet I see that some of them actually sit on committees who make these cuts. And so I'm begging and pleading that we set aside things that are biases, and we just do a really great job leading, because you've got 4 people on this recording alone who are leading as best that they can and maintaining decorum, because they're facing some difficulties in doing it anyway. But this is a shout out to all of our politicians to get involved and to help lead and give us direction as to where we should go next. And so I want to thank all of you for joining us today. And I'm looking forward to how we'll be contacted and receive word as to where we're going next, because I don't know about you, but I would really love to know what was the game plan. Where did this come from, and why does it need to happen, and where should we go next, and what are some things we should do next, because perhaps they know that we should have funding in other areas, or it should be rerouted a different way. I look forward to knowing about that. So we'll do a follow-up show if that happens.
You know, Chantele, to piggyback on what you just said about our politicians, it's not only up to them, but it's up to the people to hold those politicians accountable. And that's we the people. That means all of us, we the people. We make the decision who we want to help us. So it's up to you guys to do something about it, like I said before. So I just appreciate you guys coming on and telling the truth of what's happening in our community, because this is not only affecting our community, but it's affecting families. You know, really real households that rely on the funding and the resources that you guys give to them. So I'm really concerned about what's going to happen and what that looks like in the future.
Aaron, If I could
But-
say, Aaron, I think, and Laura mentioned this a little bit too, this is the first cut
Yeah.
that we're feeling in Monroe County.
Yeah.
But there could be many, many more cuts. And so if we are not active now, and if we're not vocal now to say how this is going to impact us and to say, no, we can't afford these cuts, they're only going to potentially get really worse. The proposed cuts to the Medicaid budget, the federal budget, would be devastating across not just Monroe and Michigan, across the entire United States. We have a lot of people depending on Medicaid in this county for many, many reasons. As Laura said, food benefits, housing assistance, mental health treatment, substance use treatment. We've done some great things in this county. These cuts, it's not an exaggeration to say they will devastate Monroe County.
And I tell people it's a life and death. These are life and death issues. And it's up to us as, and whatever ideology or political background you have, I just say, look, I'm a humanitarian.
Mm,
And this is a humanitarian crisis.
yes.
And luckily with the United Way, our state group, our Michigan Association of United Way, is working with the Michigan Nonprofit Association, the Community Foundation of Michigan Association. And they're advocating on a larger level too, and at a higher level. So working with them, and they want this data. They want to know what's happening locally so they can help as well.
That's wonderful.
Yeah.
Thank you so
fantastic.
much, everybody, for joining us.
Thank
Chantele,
you.
Well, thanks for
why we
having
do
the
our
show.
Thank
Yeah.
you.
Yep, thank you.
And with that being said, Chantele, we're going to leave them with love and respect
And unity to inspire change.
in order to see clearly.
You have to see gray.
We see gray.
To you.
Peace. One love.
Thanks, everybody.
Thank you,
Bye.
guys.